The Affordable Care Act was a way to try to find health care for all. The debate is how best to do that. There are those that think it should be in the private sector where companies provide that, but we recognize that some companies cannot afford to provide that. There are those that believe that it should be up to independent people to just go get their own health insurance, but we recognize that that is not obtainable as well. There are those who believe that it's best left in the government to decide and use what's called socialized medicine. There are a lot of people that fear that, although Medicare and Medicaid are the fastest growing percentages in this nation. What we saw in the Affordable Care Act is a lot of individuals that identified themselves that they actually qualified for Medicaid. And Medicaid was traditionally looked at for those for the poor, but recently with the downturn in the economy in a lot of areas, there's a lot of people that recognize themselves that they now qualify for Medicaid. Medicare has always been viewed as something that we earn, we work for, and then we retire and we get. Now with the different economic situation that's going on, there are a lot of folks that say, you know what, I do identify myself at Medicaid. So there are those that said we could have accomplished the Affordable Care Act, saved billions of dollars by just putting people in the Medicaid. But it depends on where you are. It's not a one-size-fits-all. In Atlantic County, I am here to tell you that it was a good thing, the Affordable Care Act. With the casino closures and that spin-off to other people losing their jobs from feeder organizations for businesses that provide services as casinos, many individuals who worked hard their whole life found themselves without medical benefits. They now have access to medical benefits, and if it had not been for the Affordable Care Act, they would have not had them. If you're in a very wealthy community where you have access to those benefits or jobs with those benefits, it's irrelevant potentially. If you're in a community that it's not quite sure where it goes, but maybe some companies might what's called dump you into the exchange, it could be a bad thing because you could lose really good benefits from your employer and end up with less benefits. Get educated, understand what the Affordable Care Act, because there's a lot of discussion on it, and it will continue. Thank you.